Hi, everybody. Another week of DocTalk. Another good week in terms of news related to coronavirus. We are at a period of time across the nation now where it appears that we have really stabilized at a low level of activity around coronavirus. So let's talk a couple of numbers for you. So we're now at a stage where there are about 12,000 admissions a day to United States hospitals related to COVID. 12,000 a day is us back, 2 years plus now in terms of the frequency of disease and the impact on hospitals. Many of those patients are older patients and ones that have had a failure of their immune system and possibly their immune system, even when vaccinated, that they end up going in the hospital. We know that case counts are now reported low because there are so many home tests that never get reported to public health. So no doubt there are greater numbers of cases in communities of people who are not very sick. Where I am standing right now, my neighbors catty corner across the street, both of them went to a wedding. They had people with infections at the wedding and people that came home with infections. Neither of them are very sick. Both of them are vaccinated, and they are never going to get counted in the number of COVID patients. We are seeing in a few areas a few medic runs that go out related to COVID, but nothing near as serious as it was. So where we are is in the stage of BA2 infections, so Omicron type BA2, which is very infectious, and it's moving through the communities, but we are at such high levels now of people who've either been vaccinated or been infected or both, that really the disease doesn't have a chance to grip a lot of Americans and cause serious illness. So that's a good thing. So the numbers now are going to be followed in terms of hospitalizations rather than cases, because those will be a better way for us to know what the real impact is on health of Americans. So it's a change, but it's a very important change and probably much more relevant to us in fire EMS at this point. Another important number that came out this week is the CDC says when they test people and look for prior infection, so that's a particular kind of antibody that they have in their blood system. When they look at that, they estimate that about 60% of Americans have been infected since the beginning of this, 60%. And it's even higher, frankly, in children, particularly older children and adolescents, who seem to have spread the infection, but not really been seriously ill with it, first of all. Second of all, many of them weren't tested. And so they're coming up with people who test positive for the antibody, but never have had symptoms that they went and got tested for. So just so you're aware, that means our herd immunity is much higher. Because when you take 60% of Americans have had an infection or have evidence that they had an infection, plus about another 66% who have had the vaccine, the entire vaccine series, and above that 66% of people who are vaccinated, about 100 million of those people have also been boosted. So there's a crossover of many of those people that have been vaccinated and had infections. And we are getting to levels where the virus is looking around for people to infect and it's not finding them. So that's good news for all of us in terms of how any future minor variants of COVID are going to affect us. And second of all, about not causing serious infections, even if it finds somebody that it can infect. So this is now like us getting colds or getting the flu when we've had a particular kind of flu in the past, and now we get a different one. So you've had H1N5, and now you get H3N2, and it is an infection, but typically not serious. And so that is called an endemic state. So you're going to hear this word, and you've heard it before here because we've talked about it on DocTalk in the past. But an endemic infection is one which is present in the community. It does not require a mask mandate. It does not require vaccine passports. It does ask people, if you're infected, don't go to work, don't go to church, don't go to concerts, don't go to weddings when you're sick. And that's a change in behavior about going to work sick. It means that vaccines are still a good idea. We'll talk about vaccines in a minute here. It means occasionally when infections get really high, you may have to shut down a business or a school or ask people to wear masks, particularly those that are at risk within that population, which we've done for years in terms of not only respiratory infections, but every once in a while GI infections. And we've had situations where businesses or teams have had outbreaks of like norovirus, and they've said, hey, we need everybody to stay home for a couple of days, so we quit having the stuff coming out both ends, which is what norovirus is, a GI virus. We've had situations even in the fire service where MRSA, which is a skin infection, has broken out. And my experiences are typically in recruit classes and in training situations where you got a group there and they're, for example, sharing a locker room or something. It also happens in athletic teams frequently, and they are spreading skin infections. When they do that, they break them apart for the while and break the cycle of infection. And that may occur in the future for COVID. And in certain communities, it may get high enough and spread through enough businesses or schools that we have to resort to asking people to wear masks, don't go to work or school sick, and then occasionally send everybody home and tell them not to come to work or school for a bit. One of the pieces that they're going to look at that we all should be aware of in our industry, ventilation systems and rooms and classrooms that are not ventilated well are a high risk for respiratory infections, and we've already proven that. And so moving anything that you can into a room or an outside environment is a really good way to stop infections. We are probably going to hear about healthy buildings. And very frankly, in the future, it may be part of our building inspections process to look at circulation, look at levels of carbon dioxide in certain buildings and classrooms and know when they're pretty high and would indicate a potential infectious spread environment, okay? Anyway, that's what endemic looks like. We begin to look at different things to reduce the risk of infection, knowing that it's going to be present in the community. At this point, it doesn't ever appear that we're going to knock COVID-19 out of circulation. There are pools in people, there are pools in critters, and at this point, it's probably what we are going to be facing for years to come. What will we do for years to come? Well, we will have vaccinations, and vaccinations may prove to be needed every year or couple years. A really good process to look at potentially is mixing the COVID vaccine with the annual influenza vaccine, so that in the fall or other risk times you get immunized to it. And that may be where we are into the future. For those of you with healthy immune systems who've been vaccinated and boosted, I recommend right now, it's beginning of May, I don't recommend an additional jab right now. For healthy immune system people, we probably should wait until the fall and take a look at what's available then, and if they've tweaked the vaccine to take into account new variants, which now we can do with the mRNA vaccines. We may add it to the flu vaccine so that you only have to get one shot in the fall that covers flu and an update on COVID, et cetera. So that is for our healthy people now. For those of you not boosted, you may want to get that additional jab at this point to protect you for the summer and into next fall. The other big news in the vaccination world this week is, how about the kids? How about the kids? The Pfizer vaccine, they have now applied for booster capability for children that are 12 and older. And so that has not received official EUA emergency use authorization from the FDA, and Pfizer has applied for that. Moderna today actually applied for approval for their vaccine for children from 6 months to 5 years of age. And so working on now vaccines available from 6 months and up. The other news of the week is ongoing work in getting an oral formulation or a nasal formulation that is particularly popular with kids. That's nowhere near approval state yet. But for many of you, you want your younger kids vaccinated. And in particular, you want to vaccinate if somebody else in the house is at risk, or if that child has asthma and other diseases that put them at risk. There's a lot of you waiting for that. And as a matter of fact, there is a group of parents in this country who have asked the FDA in particular to approve any pediatric, and pediatric here means 6 months to 5 years of age, to get those vaccines into the emergency use authorization process very quickly. What that means for us is by summertime, we may have a vaccine for the little kids and boosters for everybody up through the ages. And then over the summer, modifications of the boosters, even for adults and other people. So continued movement on the vaccines. No new news in the world of treatments. Again, good news in terms of hospitalizations, ICU admissions, and deaths. Those are all decreasing or stable. And when stable, they're stable at a low rate. So we're having good news in DocTalk this week as we move into May. We're in wildland season in many parts of the country. All of you be careful. And for those of you in the severe weather zones, and you know who you are, boy, the severe weather outbreaks are occurring, and they're a challenge to all of us in fire and EMS. So take care of yourself, take care of your family, take care of your community. Another week of DocTalk. Take care of yourself and stay healthy. Thanks.